Hi.
Hello, everyone. We're so happy to be here with you this evening. Welcome to Cannabis Live, and we're so excited to be here. My name is Heather, and tonight we're going to be discussing endocannabinoids and how they affect the body. So we're excited to get started, but first I want to welcome Amanda. She is our amazing educator at Hempfield Botanicals and Hempfield Apothecary. So welcome, Amanda.
Hi. Happy to be here, and I guess Happy New Year. I haven't seen
Yeah,
your face this year.
that's for sure. Happy New Year to everyone.
So
Uh,
I'm excited. We're going to talk about endocannabinoids and phytocannabinoids from the
yeah,
plant. So
so exciting. All right, so we'll get started. Amanda, do you want to just really briefly introduce yourself, just
yeah.
introduce new viewers a little bit about your background?
Sure. So my name is Amanda. I am actually in Texas. I am a cannabis educator and activist, and I am a licensed esthetician. I teach cosmetic chemistry, and I'm an herbalist. So I all things plant. So I am really excited to sort of combine my two worlds of skincare and plant and herbalism and cannabinoids and cannabis. And it's nice that all my worlds have collided over the last couple of years. And my favorite thing to do is to educate and talk about the plant. And I think that this is our third or fourth one to do this.
Mhm.
And last time we talked about the endocannabinoid system and endocannabinoid deficiency syndrome. So hopefully today we'll offer a few more details to sort of pull that all together.
Tie it together. Yeah. And everyone, you're in for a treat. If you have not yet been able to attend one of our live presentations, Amanda is absolutely an amazing wealth of knowledge related to cannabis and lots of other things too. And she's just an
Oh,
all amazing person. So we're so
oh,
glad
thank
you're
you.
here.
Thank
So,
you. That's sweet.
aw,
So let's get started because we just don't have
perfect.
a ton of time. But first, let me just talk about like what is a cannabinoid. You have your endocannabinoid system that we talked about that recently. And your endocannabinoid system is made up of those receptors, the receptor sites, and it's made up of modulating enzymes, and it's made up of endogenous, meaning internal cannabinoids. So your body produces these endocannabinoids. But what we're going to focus on today is phyto, meaning from the plant, phytocannabinoids. So, or exo, like outside your body cannabinoids. So, those are the cannabinoids that have an effect on your endocannabinoid system that are sourced externally, that are sourced from the plant. We have, if you count all of the acid forms and the carboxylic acid forms and the non-acid forms, we have close to 200 phytocannabinoids that we know of. And primarily, yes, those are from cannabis that we know of, but they can come from other plants. We're learning that, especially terpenes, which we're going to talk about that next time, but terpenes can even play, kind of pretend to be and have the similar effect to cannabinoids. So if you, Heather, want to throw up the endocannabinoid system man slide, then let's just kind of go over some of the receptors. The receptors that we primarily think of with cannabinoids in our endocannabinoid system are the CB1 and the CB2 receptors. Those are the ones that we have the most knowledge about. We've done the most studies. Those are the ones that we have been Professor Raphael Mechoulam discovered, so to speak, or found. And those are distinguished by um, location, but there's a lot of crossover with those. So your CB1 receptors are primarily found in your brain and your central nervous system, and your CB2 receptors are found more in your peripheral system, in your organs, your immune system, and in your gut. But that's just primarily, there's a lot of crossovers. There's a lot of places where both CB1 and CB2 receptors lie. In your skin is one of a big one. So on the slide, you'll also see that there are TRVP1 and 2, which those are really not exactly endocannabinoid receptors. They're more of a like an ion channel that your endocannabinoid receptors can modulate and affect. So, in other words, the receptors can send signals to these other channels like the TRVP1 and 2. And there's a lot of those found in your skin, also in your muscles and some of your organs and in your bone marrow. And then there is GPR18, GPR55, GPR 119. I have even seen that there's a whole lot more than this. But really what we mostly know about is the CB1 and the CB2 receptors. Anything that's not a CB1 and CB2 receptors, often you'll hear those referred to as like orphan receptors, or maybe secondary channels that the receptors sort of have an effect on. So depending on the endogenous, the internal cannabinoids, and or the phytocannabinoids, depending on what cannabinoids your body is producing or you're consuming, that depends. That will have an effect on certain receptors in certain ways. So let's kind of narrow that down a little bit. So in the plant world, in our cannabis plant, which includes marijuana and hemp, right? Mother Nature doesn't have quite as distinctive a definition between those two as we do now in our modern day growing practices, and then certainly in our federal laws and regulation. But that cannabis plant, there's essentially 4 families of phytocannabinoids. There's what we all know of THC and CBD. There's also CBG, which is cannabigerol, and CBC, which is cannabichromene. So most of our phytocannabinoids from the plant come from or can fit into those 4 families. They all have the ability to affect CB receptors or other ion channels. They don't all affect the CB receptors directly. Some of them have an indirect effect on the receptors. So the more we know, the more we study this plant, the more we're able to study the endogenous cannabinoid system. And then also think about the more plants that are being cultivated and hybridized and blended and created. And we're starting to create plants that are richer in certain cannabinoids than they were in previous genetics. So then we have more things to study, right? We have more cannabinoids to study. And one thing we do know for sure is all of these cannabinoids work better together in a whole plant formulation, which would include other things like the terpenes and the flavonoids, but having all the cannabinoids in a whole plant formulation gives you sort of that entourage effect. So primarily we discuss CBD and THC, and we know that for sure, because lots of studies have been done on these two, right? That the efforts of CBD, or the effects of either CBD and THC are unique when they're together. So the effect you have of taking CBD, the effect you have of taking THC are going to be different and better together. So the sum of the parts are greater than the whole. You have we know that we have pharmaceutical cannabinoids, right? A lot of us have heard of things like Epidiolex and Marinol and Sativex, and I'm probably leaving some out, that are either synthetically derived or naturally derived from the plant. And so because we have those and they're FDA approved pharmaceutical products in our country, and then also there's some others that are approved in other countries. We know that there is a scientific potential for cannabinoids, right? So to deny the medicinal value of these is obviously politically motivated and not scientific. So there is a lot of research out there. Obviously, drug companies are doing that research to develop these products. And so it's real. They really have a great effect on the body. So let's maybe break it down into a few special ones. Our next slide, if you want to go to the one, I think that's the colorful wheel. So that I love this one, and if you guys have access to Leafly, I took this right off of Leafly. They have some really nice graphics, but this is going to be a real general sort of description of what these cannabinoids can do, and you'll see the first thing that you notice is how much crossover there really is, right? How much crossover there is in the very center of the wheel, where you have pain or sleep or gastrointestinal, mood, behavior, neurological, and other. A lot of these cannabinoids are used in different categories, and that is because we have receptors all over our body, and those cannabinoids can sort of have an effect on each other and regulate and modulate and sort of boost and emphasize each other. If you want to leave that up there for just a minute, I'll just talk about kind of a few of our famous cannabinoids. So what's the most famous cannabinoid? THC, tetrahydrocannabinol. So THC works directly on some of your receptors, the CB1 receptors, and it works indirectly on CB2 receptors. It really does help to boost the effects of other cannabinoids, especially CBD, and CBD also helps boost the effects of THC in some ways. Primarily, we think of THC for things like pain and mood or behavior or psychological sort of disorders, if you will. The way that I think the thing that's most fascinating to me with THC, and I'm happy to sort of share my own personal example of that, is the way that THC works on pain and works on mood is that it decreases the signaling from the sensory part of the brain to the emotional part of the brain. So if you can disconnect, by disconnecting the emotional impact that pain or depression or PTSD or trauma can have, then that eases the experience of the pain or the mood disorder. So I say that because I know a lot of people that use cannabis for PTSD, and they need the THC portion of that. And I'm a migraine sufferer, and I have had conversations with people that use it for PTSD, and we have had similar experiences in that if I use something high in THC that's in a whole plant formulation, it doesn't always get rid of my migraine. I can really still feel the pain, but I just kind of don't care as much, to put it simply. I just I don't notice, I'm not as focused. It's not really mentally as taxing on me, the pain. And the same with some people that use it for PTSD is it gives your brain a temporary relief from that trauma and that anxiety and that sort of mental pressure that you're under when you're experiencing these sort of mood altering effects of PTSD and trauma. So if you can separate yourself from that emotionally, then you can process some things, right? You can really sort of process your trauma, and sort of get a handle on your anxiety, and maybe kind of push a pause button on the physical effects of the migraine or the trauma, and sort of process it, or at least kind of get a mental break. So I think that I mean, what else does that? There's no other cannabinoid that does that directly, and I don't know of another actual drug that does that directly in that way. So that's the thing. We know it does pain and sleep. We know it helps us with those. It also has a great effect on nausea and lots of inflammatory conditions. We think so much about CBD as being the anti-inflammatory cannabinoid, and it is. It has a direct and immediate anti-inflammatory action, but THC has an indirect effect on modulating inflammatory pathways. So they both work on inflammation, just differently. Also, cancer. I'm not ever afraid to say that there are a lot of studies, and there are a lot of testimonies that people have treated and effectively consider themselves healed of certain types of cancer. So we absolutely need more studies, right? But we need federal access to THC to do those. So THC, that's the one that we all know a lot of because it's been sort of around the longest. It was discovered, if you will, by Raphael Mechoulam, it was discovered first because it has such an obvious, visible, measurable effect on someone because it is psychotropic, right? CBD, let's do CBD next. So CBD, far less considered psychotropic, but when people say it doesn't have a psychological effect, I don't like that term at all, because if I can lift your mood and sort of change your outlook on life, if I can lift your depression and ease your stress and your anxiety, then certainly I have had a significant, even psychoactive, if you will, psychoactive effect. And CBD can work on mood as well. It works in a different way than THC. It works on different receptors. Lots of times, anxiety is getting in the way of all the other healing that we need to do. So if I can eliminate and ease and just even crush at times that anxiety with CBD without giving you a psychotropic effect, because that's not always ideal, right? We can't always have that psychotropic effect from THC. But if I can eliminate some of your anxiety or lift your mood, then you're going to heal in many, 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 many ways. I love this wheel this slide that Heather just threw up here for us. I think that this one's nice and simple and really focuses kind of on the cannabinoids that we know the most about. The CBD portion is huge, partially because I think I got this from a CBD study directly, but because we've done so much studying on CBD, we know a lot of things that it can do. But I personally think that, as fantastic as that is, the reason that we think CBD does so much is because, one, it's available in the plant, and so we can study it, and two, because it's had so many studies done on it, we've discovered all these things. But once we get into more of our CBGs, which there's a lot of great information on that, and even CBN, I think that we'll be adding to that list of effects that the other cannabinoids can have. Which one should we do next? Let's do CBN. So CBN is actually not a cannabinoid that's found in the plant. What? It's not a cannabinoid that's found in the plant. CBN is the result of oxidation of THC, essentially. So in the plant, we have THCA, which is the acid form of THC before you've heated it, essentially, or decarboxylated it. CBN is the result of heat or light or oxidation, or essentially just time can degrade it degrade your THC into CBN. So that probably sounds like a lot of us have accidentally had some CBN products that we have let degrade, right? But they have medicinal value as well. They have that promotes bone growth. I think that with CBC, those two together, I think there's going to be a lot of like osteoporosis type applications with those two cannabinoids. CBN is known for being the sleepy cannabinoid. So THC does actually help a lot of people with sleep, but there's that, you walk that tightrope sometimes between too much THC makes you sleepy but keeps you awake, because it can produce a little bit of anxiety in especially newer users. Well, CBN is much more sedating. CBN has a much sort of a sleepy effect, and as an appetite stimulant. So a lot of our cannabinoids have the ability to do that. THC has the ability, and even some terpenes have the ability to do that. But CBN, there's been a lot of studies on how it really is a significantly better appetite stimulant than some of your other ones, which has such a great application for eating disorders or people that are ill, or possibly going through chemo, or just are underweight. So that's your CBN. What do we want to do next? CBG. I want to do CBG. So CBG, I think, is going to be and really in some ways it already is. I think that that's going to be our next superstar cannabinoid. I think that's going to be the one that has a lot of science behind it, because we're already seeing a whole lot of science behind it. It is actually found in the plant as in an immature plant. So when the flower is young, it's a precursor to THC, CBD, and CBG. So in other words, CBG is the mother cannabinoid that then later evolves into your specific cannabinoids that we just mentioned. So it also actually, which this is good news because hemp is legal nationwide, right? CBG is less present in marijuana, if you will, your higher THC plant. It's less present in marijuana and more present in hemp flower. And like I said, it's less present in your mature plants. So to harvest a flower that's high in CBG, they have to take the flower at a younger age. So that means they're harvesting it for CBG, which is fantastic, but it didn't have the opportunity to evolve or develop into your other cannabinoids. So that's interesting. I think there's been a lot of studies on CBG and cancer. So I know that that's not on our wheel. A lot of people don't like to put cancer in their claims, but because I'm not giving you medical advice. I'm just telling you what I know. There has been an enormous amount of studies on CBG and sort of apoptosis, if you will, which is what I mentioned earlier with THC, and that's just where the cells die off. The unhealthy cancer cells die off, where the healthy cells are left intact. So CBG, there's some studies on that, and as an antibacterial, which is pretty cool, right? That we would have another option for antibacterial. CBG has been used in the treatment of MRSA, which is a bacterial resistant infection. So you have CBGA and CBG both on here, because one would of course be the acid form in the plant, and then one would be after it's heated or decarboxylated, and you lose the acid. So most people, I think, are familiar with the fact that you can't just eat cannabis and feel stoned. Like that's a real common knowledge. Anyone who's ever tried to do that knows that it wasn't very effective, and you had to, heat it, bake it, or smoke it, right? So the reason that you do that is because you're decarboxylating. You're taking that acid molecule. If you, from the last slide that had the THCA, you're taking that acid molecule away, and you're bringing it to what some people call the neutral state. And it just has a different effect. So there is a place in this world for the acid forms of these cannabinoids and the non-acid forms. That's why when I said earlier that we have something like close to 200 phytocannabinoids, that's why, because I'm counting the acid form and the non-acid form. So I kind of left CBD for last because I think that there's a lot to cover with CBD, and everyone seems to know some main things CBD does, right? Everyone is familiar with it's anti-inflammatory, it's anti-anxiety, and then it's good for pain because it's anti-inflammatory, especially topically, but it's neuroprotective. So I am in a state where our medical cannabis program is very, very, very low THC and very, very high CBD. So it would be nice if we could get that changed, and we're working on it. But because it is so high CBD, the people that are most helped by our product are the people that have neurodegenerative issues or inflammation issues, or seizures. So anything neurological, because it is so high CBD. One thing that I found that I really was impressed by with CBD was lowering blood pressure. That's a big one. I've seen that in a lot of patients that I've consulted with. My mom got off of her high blood pressure medicine after putting her on a good CBD. So CBD is primarily found in a greater abundance in the hemp plant than it is in the marijuana plant, but because of the popularity and the great effects that CBD can have, a lot of growers and cultivators of marijuana are trying to bring in more CBD into their genetics. As you can imagine, that would be ideal if you were a grower, right? Um, the nausea, I have used this with great results for altitude sickness, so I can definitely attest to that. And then this also has an antibacterial component to it as well. We could go on and on and on about CBD. I think that the things that people believe that it makes you sleepy, I don't think that it has. I don't think that it's sedating. I've never seen anyone that is sedated by it. I almost said except my dog, but she sleeps a lot anyway, so how would you know? But because CBD can take away so much of your mental, right? Take you out of your head a little bit and take away so much of your mental issues, anguish, if you will. It can take away your anxiety and lift your mood. And with the anti-inflammatory action can ease pain. And if I can take away your pain and make you comfortable and have less anxiety, then you're going to sleep better. So I think that everyone probably that's watching today has had some experience either with CBD or knows someone who has, or they're interested in using CBD to treat particular ailments. And it's such a great place to start because you don't have the psychotropic effect, and it is so accessible. It is better used in an entourage effect of the other cannabinoids and terpenes that were available in the plant, mostly because they all kind of have an effect and a boost on each other. But CBD in an isolated form has been wonderful for a lot of people, and certainly a good place to start. Um, we we could do this for like another 2 hours and still not cover all the cannabinoids. And I could do this again in 2 months, and there would be more information on the cannabinoids that I know of. So it's really just an incredible plant that we have. The plant is really doing really a lot, and there's so many studies that are coming along. And the more we have access to the plant, in other words, with federal laws, the more access we have, then the more things we're going to discover that it can do. So there's a whole lot like crammed in your ear right there, wasn't it? So we'll wrap it up. But in 2 weeks, on January 27th, Heather and I are going to do Cannabis Live again. And we're going to talk about terpenes, which is my favorite thing to talk about because it crosses over into all the plants that we love. But I hope that you'll join us back in a couple of weeks for that same time. And if you have any questions, you just reach out to us and we'll do our best to get back to you. Thanks.